Greater Glasgow and Clyde Health Board have paid a private company to spy on Louise Lawrence, a grieving widow who lost her husband in the Queen Elizabeth Hospital's infection scandal. Why does the First Minister have confidence in the leadership of a board who spy on the families of dead patients? First Minister.
First and foremost, Presiding Officer, can I once again give my condolences to Miss Lawrence, to Louise Lawrence, on the death of Andrew Lawrence. Andrew Lawrence was a colleague that I worked with when I was Transport Minister in particular, and the work that he did on resilience. On the back of a previous question that Anas Sarwar has asked, I've reached out to Louise Lawrence, and I believe we're going to be meeting shortly, and I'm happy to discuss these issues and any other issue that Louise Lawrence wishes to discuss. I was also disturbed by the reports that were in the newspapers in this regard. My understanding is that, of course, you would expect, and Anas Sarwar, I'm sure, would expect that there is a level of media monitoring that does take place by a board, particularly one the size of Greater Glasgow and Clyde. But having listened to the concerns that have been raised by Louise Lawrence, I think Glasgow have taken the right action, Greater Glasgow and Clyde have taken the right action by removing Louise Lawrence from that media monitoring that they have. And I would request Greater Glasgow and Clyde, and I have already requested Greater Glasgow and Clyde, to listen compassionately and listen sensitively to those patients that have been impacted and have been affected. So I understand they're reviewing their media monitoring and their communications processes, but they should absolutely, at the heart of it, have patients, particularly those that have been bereaved and those that have raised concerns about these particular issues.
Anas Sarwar.
Presiding Officer, what the leadership of this health board is doing is disgusting and is just the latest in a litany of shameful incidents that has seen the leadership of this health board intimidate whistleblowers, engage in a cover-up and frustrate the efforts of grieving families who are looking for justice. And instead of backing patients, Humza Yousaf, as Health Secretary, decided to take the board out of special measures and empower those responsible. The culture in this board is rotten. So rotten that their Director of Communications allegedly thought it was acceptable to say of a father fighting for justice for his sick daughter, and I quote, "He may have won the battle, but he won't win the war." Louise Lawrence, John Cuddihy and other families have been treated with contempt. So I ask the First Minister again, why does he have confidence in the leadership of this health board?
First Minister.
I take the issues that Anas Sarwar raises and has raised to his credit for many years extremely seriously, and that's why, of course, we know we have a public inquiry underway, which, of course, Greater Glasgow and Clyde and indeed the Scottish Government will cooperate fully with. In terms of whistleblowing, let me make it clear, as I have done in my previous role as Cabinet Secretary for Health and Social Care, that we don't just value the role that our whistleblowing champions place. We believe that their role is absolutely critical. I met with, of course, the whistleblowing champion of Greater Glasgow and Clyde. In fact, I've met with whistleblowing champions of every single health board in the country. And I have, and I will do as First Minister, reiterate and emphasise that anybody that has concern, any staff member that has concern in the NHS, they should absolutely raise those issues through the appropriate processes, including, of course, feeling empowered to use the whistleblowing processes that exist. In relation to de-escalation, Anas Sarwar will know there is a process in place, and because the vast overwhelming majority of the oversight recommendations were accepted, then it was right, of course, to de-escalate Greater Glasgow and Clyde at the time. So we will judge Greater Glasgow and Clyde in terms of how they step up and accept those recommendations and implement them. And what we will also do is fully cooperate with the public inquiry in place, Presiding Officer.
Anas Sarwar.
Presiding Officer, the First Minister talks about empowering patients. He's empowering the failed leadership of this health board. Louise Lawrence's husband died at the Queen Elizabeth, and she's been fighting for answers for 2 years. Louise is in the gallery today, listening to our exchanges, and this is what she's told me earlier. We cannot wait any longer. Empty words just don't cut it. At the end of the day, the people who were in charge when Andrew and others lost their lives are still there. The people who created the problem, who covered up and lied to families, aren't going to be the ones to fix it. How much more does she and other families have to go through? First Minister, you don't need to wait for an inquiry to to know that spying on families of dead patients is wrong. You just need to look for your conscience. So why won't you finally do the right thing and sack the rotten leadership of this health board so we can get a fresh start and justice for these families?
First Minister.
Well, as I have said in response to Anas Sarwar's first question, I will, of course, look forward to meeting with Louise Lawrence and hearing directly from her in relation to the concerns that she has quite legitimately and rightly raised on a number of occasions. And I hear the words that she has expressed to Anas Sarwar and he has read out on her behalf, and I do take them with the utmost seriousness. In terms of the case of Andrew Lawrence, and again I'm happy to speak to Ms Lawrence in detail about this, Anas Sarwar will be aware that of course we did ask for an external peer review of the NHS Greater Glasgow case by NHS Lothian, and there was a determination made after that case. I have said already, of course, the Greater Glasgow and Clyde will cooperate with the public inquiry, and we will continue to hold Greater Glasgow and Clyde to account. And I will repeat and reiterate what I have said time and time again, both as Health Secretary and now as First Minister. If there are concerns raised by staff, then I would expect them to raise those issues without fear or without favour, not just through the appropriate processes, but of course through whistleblowing where appropriate as well. And of course, I'm looking forward to engaging with the Scottish Labour Party in relation to our Patient Safety Commissioner Bill, which I know Labour and other parties are engaged with, so we can of course enhance the rights of patients, not just in Greater Glasgow and Clyde, but right across the country, Presiding Officer.